Hi, my name's Ashley Sprout, and I decided to do the nurse in home health and hospice. Let's start by defining what home health and hospice really mean. Home health is defined as care that is provided by a nurse or a therapist in the patient's home. Home care can be made up of disease prevention, health promotion, or illness-related services. We'll go into this further in the next slide. Hospice is care that is provided to the very ill and dying. Palliative care is known for the management of patient symptoms. Palliative care and hospice usually go hand in hand with one another. There are different types of home care, the first being population-focused home care. This is when the nurse is going to provide medication and education to the patients in their home. They're going to teach them about their medications. They may be new. They may have just been discharged from a hospital and haven't had to use these type of medications before. They're also going to provide them education regarding their chronic illnesses that they have. This type of home care is utilized for high-risk groups and patients with chronic diseases such as your kidney disease, diabetes, heart disease, and population-focused home care can also be used for families that have infants in the home. Transitional home care is for the high-risk health problems from one level to the next. Often this is such as when a patient's in a hospital and they're ready to go home, but they still need those extra services for a while. Or if a resident or a patient is in a rehab facility and they no longer need the services in the facility, but they're okay to go home, yet they still need a little bit of extra services, this would fall under transitional home care. The final type of home care is home-based primary care. This is more when your physicians are going to round out to the homes and see the patients. It's more if patients aren't able to leave their home and make it for a follow-up appointment, the physicians are going to do a home visit. Nurses are still able to visit with the patient and provide them medications and education, and this service is often used for veterans. Let's talk about hospice care. Hospice care is an option for when a patient suffers from a disease where treatment is no longer an option. They've went through all the possible treatments and they've run out of everything. So often a patient will go on hospice care. This is when they are just going to be made comfortable. They're not going to be having any aggressive forms of treatment. Hospice care is on call 24 hours a day. Locations for hospice care: you can be on hospice in a hospital. Long-term care facilities have patients who are on hospice. Rehab facilities also have hospice patients, and you can have hospice at home. The services that are offered through hospice care: volunteers often will come in, help clean the house, and do anything that the family just doesn't have time to get done. They will provide chaplain support, financial help, and bereavement. Bereavement is often utilized towards the very end of a patient's life or after the patient passes away. I think it is important to realize that there are special requirements for hospice care. You do have to have an illness that qualifies to go on hospice. It's nice though. This service is definitely utilized for those people who are just tired of fighting and they just want to spend the rest of their time comfortable. Often CNAs will go into the home or go wherever these patients are and spend lots of time with them, whether it's doing their ADLs, cleaning them, or if it's just sitting there and talking with them and spending that one-on-one time. Hospice care provides a lot of extra attention for the family as well. One of the biggest things I've noticed is that whether it's at a facility or at home, they try and make the environment very relaxing because the number one goal is to make sure the patient is comfortable. The home health nurse and hospice nurse have many roles and functions. They're not like your typical nurse that passes medications and just does an assessment. They're going to be the clinician. They're going to be an advocate, be an educator. They may be an administrator, a case manager, a mentor. It's important to remember that these nurses are going to have multiple roles. They're going to be educating these patients every time they come into contact with them. They may need to reach out to other specialties in the community and help get them services that they need. These nurses are making up their assignments. They're billing for their services. Whereas in the hospital, the nurses don't have to bill for their services. They need to do a lot. They have a lot more responsibility here now than they do in the long-term care or even the short-term care facilities. There is education certifications that are required for home health nurses and hospice nurses. Both nurses must be a registered nurse. They prefer BSN and also MSN. Just due to the level of the complexity of care, they prefer to have a BSN nurse over just a regular registered nurse. There are special certifications that these nurses can get. For hospice, they can take tests for the National Board for Certification of Hospice and Palliative Nurses and get that special certification. However, they can also do, for the home nurse, they can do an advanced public health nurse. It is very competitive though, and they also have to currently be practicing to go through this type of certification. There's many different populations that are using home health and hospice. For instance, families with infants are going to be using home health services. Disabled veterans, as we talked about earlier, are going to be using that home-based care. Older patients who are discharged from the hospital or from the rehab facility but need those extra services. Mental health patients, end-of-life patients are going to be your hospice services. And then also skilled patients. Skilled patients is anybody that has a wound that's receiving IV medications, injections, or that have chronic illnesses. They're going to require those extra education and extra nursing skills to make sure that they're receiving the care they need. These patients aren't going to know how to do their own IV medications or how to perform the correct dressing, so they have these nurses come in, do an assessment, and help out with these services. Another form of home health care is therapy services. The different forms of therapy, whether it be physical therapy or occupational therapy, can also come in the house and work with these patients. Usually it'll only be for a couple weeks, but it's to keep them up to their baseline so they don't decline from when they were just recently discharged from the hospital. These skilled patients, however, you do need to meet certain requirements with the insurance. Some insurances will not cover home care if these patients don't have a skilled need. So these couple examples I have listed here are just some of the needs that insurance will cover for patients to be discharged with home health services. The nursing field is a growing profession, especially with home health and hospice services. Going forward in the future, these nurses are going to have more duties. They're going to be in charge of doing more tasks instead of just seeing the patient. They're going to take on more billing aspects, more scheduling aspects. The workload's going to be increased because hospitals are discharging patients sooner. It's all about getting the patients in and getting them out. So they're going to have more patients that they have to see on a daily basis. It's also going to come down the line where they're going to start having nurses specialized to go out. So whether this nurse is specialized or certified in hearts, they're going to go see these patients who are suffering from heart diseases, whereas another nurse maybe will specialize in geriatrics. They're going to see more of the geriatric population. With their workload increasing, I can also see them using the telehealth system more. Telehealth is something new that they are utilizing now, but I can see them using it more as their workload becomes harder. Telehealth is when they are able to remotely connect with the patient. They can connect via the computer, via this machine as you see here in the picture. Physicians are also able to ring in and see the patient and almost perform a full assessment as if they were actually there in person, although they could be hours away from where the patient actually is. Telehealth is using this technology we have to still provide care for these patients. As with everything, you're always going to face challenges or adversity. First thing, there may be some nurses who don't want to go on for their bachelor's. This could ultimately prevent them from becoming a hospice or home health nurse. Infection control is something that is extremely important in the home care setting. These nurses need to remember that they're going into these patients' homes. They're not sure what they're going to be getting into. So they always need to make sure that they have a barrier between them and their patients. They need to make sure that they follow the infection control and have a special layer down before they put their belongings on the patient's table or couch or etc. One of the biggest things with being a hospice nurse or a home health nurse is gaining the client's trust. These patients are dealing with these nurses on a daily basis. They're putting all their faith into them with their care. So you really need to make sure you secure that trust in the beginning with those patients so that they can open up to you and let you know if something's really wrong. Another challenge they could face is the patient workload. Some of these home health nurses may have a ton of patients, and for them to fit all of them into their schedule can be very time consuming. There's a lot of charting that goes on with these home health, so they need to make sure that they're spreading it out, but also ensuring that they have adequate amount of time with each patient, and that these visits are not being rushed. Another challenge is getting the insurances to cover these services. It can be very hard to get insurance companies to approve home health care. So as we talked about in the previous slide, skilled services are a great way to go, but if a patient doesn't have a need for skilled services, they may run into trouble getting approval for home health or even hospice. And finally, the challenge is documentation. Being a nurse, you know if you didn't document it, you didn't do it. Everything must be documented from that home visit or that hospice visit from the nurse. There are some legal or ethical concerns that come into effect with home health nurses and hospice nurses. The first being risk of malpractice due to the complexity of care, rush visits, and failure to adhere to the standards of practice. Just because these nurses are going into patients' homes doesn't mean that they don't have standards that they have to follow. They still have rules, and they still need to make sure that they're not going outside their scope of practice. They can't prescribe medications or sign medication scripts. They still need to work under a physician. Secondly, another big legal concern is Medicare fraud and abuse. This is for billing for services that are not actually done. Having excessive staff on board that you really don't need, billing for non-covered medical supplies, so you'll know in the beginning whether something's covered or not, and also billing for inappropriate services. You can't bill, say you did an IV and wounds, when this resident or patient actually doesn't have any wounds. This slide is pretty much self-explanatory. Here are my code of ethic principles that I have regarding home health nursing and hospice nursing. I got these principles from the Principles of Ethical Practice of Public Health. I felt that these three principles are what fit best into the topic that I chose. I hope you learned a lot about home health nurse and hospice nurse. I think it's very important to realize that this is a growing field in the nursing community and that it's a very important field. Thank you.